Hi, good day to one and all. Myself, Dr. Nagaraj, working as a physician, professor and HOD in the Department of General Medicine. On this World Hypertension Day, I would like to inform you regarding what hypertension is and for the general public and what you to control the hypertension so that you live for a longer period. Hypertension is diagnosed when the systolic blood pressure is more than 140 millimeters of mercury and diastolic is more than 90 millimeters of mercury. Once a person is having blood pressure of 140 by 90, there are so many conditions. If the person is above 60 years, the treatment changes. If the person is below 50 years, the treatment changes. The most common causes of increase in the blood pressure, what we are seeing nowadays, is because of the stress, one is because of the obesity, and one is because of the genetic predisposition. Any person who is having a family history of high blood pressure should be aware that he might come into the group of hypertensives and they should go for regular blood pressure checkup from the age of 30 years itself. Obesity is the next factor which increases the blood pressure, which is because of what we are following, going in for the Western lifestyle. The next one is the stress. The most common stress is everybody is affected because of the stress, whether it may be because of the studies or because of the job or because of the working lifestyle. So all these factors put together puts a person into the range of becoming into hypertension. So once a person is diagnosed as hypertensive, what he can do? Even before the starting of medications, we can suggest him from some kind of lifestyle modifications. Lifestyle modifications includes reduced salt intake, change in his food habits, change into the stopping the Western lifestyle, reducing his stress, going in for yoga, and then the last option will be going in for medications. There are a lot of newer generation medications which has got lesser side effects when compared to the old generation of antihypertensive medications. These medications can be started at any age group, but before starting the medications, we have to go in for a trial of lifestyle modifications for at least 1 to 2 months, and then we will start off on medications. So all the patients who are diagnosed as hypertensive, first go for a lifestyle modification. If not controlled, go for a newer generation of medications. Do whatever possible, but keep blood pressure under check. As this World Hypertensive Day, the theme goes in like keep control the blood pressure and have a longer lifestyle. So to have a longer lifestyle, keep your blood pressure under control by going in for regular blood pressure checkup and keeping your stress under control. So any person who is diagnosed as hypertensive, first we will put him on lifestyle modifications, which in almost 50% of the patients brings the BP under control. The remaining 50% of the patients, we will put them on newer generation medications which have got lesser side effects and brings the BP under very good control. For a longer lifespan, I would suggest everybody should get their blood pressure checked at least once in 6 months to one in a year, at first from the age of 30 years. So for a longer lifespan, I would suggest you to go for a regular blood pressure checkup on this World Hypertensive Day. Thank you.